we had the honor at the ASCO 2021 plenary session to present first result from KEYNOTE-564. This was an adjuvant study of immunotherapy with the immune checkpoint inhibitor Pembrolizumab versus placebo in patient with risk of recurrence after a curative intent nephrectomy. The study is based on the fact that immune checkpoint inhibitor do have activity and are standard in metastatic disease. So we were trying to take that concept to the earlier stage disease to see if recurrences could be prevented or delayed. Overall, we enrolled over 900, closer actually to 1,000 patients with intermediate high, or M1-NED, clear cell RCC or sarcomatoid histology, and they were randomized 1-to-1 to receive pembrolizumab or placebo for the duration of 1 year. The primary endpoint of the study was disease-free survival by investigator assessment. Safety and overall survival were a secondary endpoint. And the analysis for the primary endpoint was overall event-driven, and at that time we had enough events to look at the primary endpoint. Overall survival remained immature, with less than 30% overall of events that were that happened. Key finding were the fact that the study met its primary endpoint in reducing overall the risk of recurrence or death by 32%. The hazard ratio was 0.68. And when we look at different risks and at different categories, and when we look at several subgroups, the benefit was in all subgroups, with the hazard ratio being less than 1. We looked also at safety and overall survival. As I said, with overall survival, there was a few events overall, but nevertheless, the overall survival hazard ratio was quite promising. Didn't meet statistical significance, but hopefully we're going in the right direction, which is quite encouraging. The safety results also were presented, and overall, despite the toxicities, the all-grade and the high-grade toxicities were higher in the pembrolizumab arm. There were no new signals of toxicities with pembrolizumab. So overall, we concluded that pembrolizumab, delays progression and recurrence of disease, and could be soon becoming a standard of care in high-risk renal cell cancer. I think this is an important question, because we struggled with adjuvant therapy for a long time. The first adjuvant trial were even in the 70s, used radiation, chemotherapies, vaccines, cytokine, all were negative. Even in the targeted therapy era with VEGF targeted agent, the results were largely inconclusive. There is one FDA-approved drug, sunitinib, from an ASTRAC trial where disease-free survival was met, but actually there was no overall survival, and quality of life was inferior during the 1 year of therapy. And when using this drug, sunitinib, or other VEGF targeted agent in other trials, there was no disease-free survival advantage. So while the drug is approved by the FDA, it's not approved by the EMA, and its use in current practice is quite limited. So I think this remains an unmet need, and hopefully with pembrolizumab, this unmet need is filled, at least in part. The study will continue to look at events for overall survival I think this will be also an important, a key secondary endpoint. I think quality of life, hopefully you're going to see in the next couple of meeting quality of life data which was collected, and of course the maturity of the data. It's important. This is a large study over, as I said, almost 1,000 patients. So we need to see how the result mature, because this the primary data cut is with median follow-up of 24 months.